Washing my hands. Good morning. My name's Summer. Can you tell me your name and your birthday?
Marie Rose, 12/16/65.
All right. And what are you here for today?
Annual physical
Okay.
checkup.
Have you ever had one before?
Yes.
Okay. Can you start by telling me your personal history?
I had my gallbladder out in 2023 and I have high blood pressure.
Okay. What about your family history?
I'm adopted, so I don't know any of that.
No grandparents, no parents, you don't know any of their history. Okay. Well, we're gonna go ahead and start with our exam. I washed my hands are clean. I'm gonna start with the head. Skin, you haven't noticed any skin issues, skin injuries, tanning injuries, anything like that. So I'm just gonna palpate your head at first, making sure there's no scars, there's no lesions. Everything looks good back here. There is like a very tiny mole back here. Have you had that checked out by the dermatologist?
No.
Okay. Any concerns?
Mm-mm.
The skin looks good. There are no issues. There are no rashes, nothing like that. So we're gonna go ahead forward with your sinuses, and I'm gonna palpate here. Any post-nasal drip, and any pain or pressure while I'm doing that?
No.
Okay. Go ahead and keep your eyes closed. I'm gonna check your trigeminal nerve here, and you just tell me where I'm at.
Left cheek,
Okay.
right cheek.
Okay. And full sensation, no concerns there, correct?
Mm-hmm.
All right. And I'm going to kind of palpate underneath the mandible here. You're going to go ahead and open and close your jaw. Any pain there?
No.
So we're just checking for TMJ. You go to the dentist regularly, no issues at all there. Okay. I'm going to wash my hands time here. And we're going to move on to the eyes. Okay, so I'm just going to kind of palpate the ducts, look at the conjunctivi, any pain or pressure there.
No.
Go ahead and open your eyes. Go ahead and look down a little bit. The conjunctivi look good. There is no drainage, nothing like that. Any eye issues whatsoever?
Mm-mm.
Any trouble seeing?
No.
Okay, we're going to do a vision test. And we're going to be testing the optic nerve. Just get this piece of paper. So we're going to go 14 inches away, and then you're going to go ahead and cover one eye. And tell me what you see here.
A, E, I, O, U.
And then go ahead and read that backwards.
U, O, I, E, A.
Okay, and then the other eye.
A, E, I, O, U.
And go ahead and read that backwards.
U, O, I, E, A.
Okay, no issues whatsoever. That's 20/20 vision. I'm going to do a little light check here, just for Perla, for the eye. Go ahead and look straight ahead at me. And they are reactive. And the other one, and that is reactive brisk. They're about a 3, round, and reactive. Do you normally wear glasses at all?
No.
Okay. I'm going to do a little quick exam with your eyes here, and we're going to check the optic disc as well as for any papillary edema here. So I'm going to get pretty close to you, okay?
Mm-hmm.
All right. There is the optic disc there. And I don't see any edema. We're going to do the other eye. Alright, and I have located the optic disc there. There's no papillary edema whatsoever. The vision looks good. Wash my hands again. Alright. So then I'm going to do, this is part of the ophthalmic exam, and the blood vessels looked okay, the red light was there. I am going to check. You let me know when you see my fingers in your peripheral vision here.
Okay.
Okay. You just let me know when you see.
Yes.
Okay?
Yes.
Okay. And then we're going to go in the front here. All right.
Yes.
Okay. All right, moving on to the ears. Any issues with the ears? Any drainage, ear pain, recent ear infections, or anything like that? Okay. Before I look inside the ears, we're gonna do a whisper test. So you let me know. I'm gonna go behind you. Let me know what you hear. Okay.
Okay. 8178. 8164.
Okay, perfect. All right. So now we're gonna look for the tympanic membrane here. And all right. And I see that pearly gray, the tympanic membrane. Is there any pain or pressure? Okay, let's check the other one here. Okay, I see the tympanic membrane. Any pain or pressure? Okay, and then we're gonna check the tragus here for your nerve. I'm gonna give it kind of just palpate. Any pain or pressure there? Okay, all right. Let's see here. Gonna look at the nose now. So the bridge of the nose, any pain or pressure, just kind of palpating it. Go ahead and tip your head up. I'm gonna look inside the nose here. Okay, other side. All right, I don't see any polyps. It looks unremarkable. Go ahead and shut one ear and sniff through there. And then the other. Did one side or the other make a difference? Okay, we're gonna do the smell test. I'm gonna give this a little spray and you tell me what you smell.
Vanilla.
Okay. Do it. Another one here. You grab the other one. Okay. And what do you smell there?
Rubbing alcohol.
Okay, perfect. Your sense of smell is great. Alrighty. Just washing off my hands again. We're gonna check the vagus nerve. One way to do it is to stick the tongue depressor in the mouth and check your gag. I'm not gonna do that exactly. Go ahead and open your mouth and say ah. And I'm gonna look in here. You still have your tonsils. Any pain or recent infections with the tonsils?
No.
Okay, so you're gonna take your tongue, go ahead and stick it straight out. It is midline. I'll go ahead and put it back in. You're gonna go cheek to cheek. And we are gonna check the hypoglossal nerve. Okay. And I saw in there you have all of your teeth. You're not missing any teeth, any recent tooth infection. Okay. We're gonna check your neck and palpate for lymph nodes. So I'm gonna palpate different spots and you let me know if there's any pain or tenderness. So we're gonna go to the occipital first. Any pain? Okay, we're gonna do posterior cervical. Pain. Anterior cervical. Retropharyngeal. Alright, submandibular.
No.
Supraclavicle.
No.
You're gonna put your arms all the way up. We're gonna do the axillary. Any pain, pressure? Have you felt lumps or bumps in there?
No.
Okay, go ahead and bring your hands down like this. And we're going to get the epitrochlear here. And then you're gonna lift your gown just a little bit up. I'm gonna do the inguinal. Okay. And no pain or pressure there at all. Okay. Have you had any recent infections, bacterial infections, anything like that?
No.
All right, I see that the trachea is midline. As she takes a deep breath in, her chest is rising and falling at the same time. We are going to do a couple of tests. I'm going to auscultate the lungs and do some percussion here. So I'm going to go behind you. Go ahead and shrug your shoulders up and down. Okay, and down. That's good. All the way down. I'm bringing my thumbs behind the back, grasping kind of where the lungs are at here. She's going to take a big deep breath in. They rise and fall equally. Go ahead and out. Perfect. Okay. then we're gonna look at the carotid while we're on the neck here. I'm also kind of looking at the JVD, but we'll go back to that. So I am going to palpate that area and checking for bruit. Okay, right there. And just breathe normal, I'm just listening. Okay, that sounds great. Take that off of here. And I'm kind of looking at her eyes at this point. I am going to go ahead and look at the thyroid. I'll go behind, but there's no exophthalmos. Eyes look good. Let me go behind here. And I'm going to palpate the thyroid. All right, go ahead and swallow. And that is intact. Okay. Here. So we are going to move on to the thoracic. Her breath rate and rhythm are all good. We're going to do some percussion here. So I'm just going to start from the back and work my way to the front. And okay, good. All right, perfect. Okay, take a nice deep breath in and out, in and out. And I'm just palpating for any crepitus. They're very unremarkable here. Everything is symmetrical and there is no crepitus. So from here, we're going to do we did the tactile pharynx. We're going to move on to the diaphragmatic excursion. So I'm going to work from behind here. And that. Okay. So with this, we are looking at lung expansion, and it should be about 3 to 5 centimeters is the recommendation. So go ahead and take a big deep breath in and hold it. Okay, breathe. And you're just going to take a nice deep breath, just keep breathing. And like I said, this is the diaphragmatic excursion. Now you're going to take a deep breath in and blow it out. Okay, so we are about 4 centimeters, so that's perfect there. Okay. Moving on, back to the carotid, I'm looking at JVD distension. There is none. The carotid I'm going to do with an apical pulse, and I can palpate them both. Her color is good. She has great capillary refill. Her skin color is good. There is no edema. I'm going to have you can you slip your sock off? All right, and she has great capillary refill here. So I'm going to check for Hohenstein. I'm going to flex your foot back like this, and you tell me if there's any pain in the calf.
No.
Okay, let's check. Can you take that sock off? All right, flexing that foot back.
No pain.
Any pain in the calf?
Mm-mm.
Okay, and we're going to go back. I'm going to listen and auscultate here. And I'm going to do this with my cardiac exam. So this is my auscultation and cardiac. So I'm just, yes, perfect. Okay. Take a nice deep breath in and out. Good. And I want to listen to these bilaterally and work my way down and back over in the ladder formulation. Okay. good. One more. Perfect. And I'm gonna go to the back and do the same thing. Deep breath in and out. And again, I'm working my way bilaterally and then down and over, comparing one lung to the other. Okay, and then I'm gonna go back and I'm just gonna listen to the heart. I'm listening for S1, S2, any bruits there, any gallops. And she has S1, S2 with great blood flow. All right. Well, thank you so much for your time. We have completed your annual exam. Do you have any questions for me?
No,
All right, well, thank you so much.
thank you.